the lie about the prostate and the general silence surrounding male intimate health has left many of us navigating our most personal years with more questions than answers. Hello, I am Dr. Emily Carter, a specialist physician with over 15 years of experience helping men navigate the complexities of sexual health and urology. I understand that for many of you watching today, the topic of the foreskin is one that was settled decades ago, perhaps at birth or during childhood. But as we enter our middle and senior years, the biological reality of our anatomy can start to present new and unexpected challenges. Whether you have lived your entire life with or without a foreskin, it is a question that men have asked for centuries, and it remains surrounded by deep cultural, religious, and medical debate. In today's world, where we have access to more scientific information than ever before, the debate is often less about tradition and more about your specific health, your daily function, and your personal choice. My goal is not to tell you which path is objectively right, because the truth is that there is not one single answer that fits every man. Instead, I want to cut through the noise and explore the natural function of the foreskin, the proven advantages of its removal, the potential risks involved, and the specific medical reasons why surgery might not just be an option for a man in his 60s, but a genuine necessity. By the end of our time together, you will have a much clearer picture to help guide your decisions and ensure your longevity and comfort. This is an essential journey of discovery that could change how you view your body and your health forever. To understand why this choice matters so much as we age, we must first start with the basics of anatomy. What exactly is the foreskin and what does it do? Medically known as the prepuce, the foreskin is a retractable sleeve of skin that naturally covers the head of the penis, which we call the glans. While many people view it as just a simple piece of skin, it is actually a highly specialized biological structure with several critical functions. The first and perhaps most obvious is protection. The foreskin acts as a natural sheath, shielding the highly sensitive glands from constant friction against clothing and from exposure to bacteria or irritants in the environment. You can think of it as a built-in protective barrier for one of the most delicate parts of your body, which is especially important if you lead an active lifestyle or find that your skin is becoming thinner and more sensitive with age. Beyond protection, there is the vital matter of moisture and lubrication. The inner surface of the foreskin helps to maintain a moist and chemically balanced environment around the glands. This natural lubrication can contribute significantly to comfort during sexual activity, a factor that becomes increasingly relevant as natural fluid production may change in our later years. Finally, we must discuss the matter of sensation. The foreskin is an incredibly nerve-rich tissue containing thousands of fine-touch nerve endings that are highly responsive to stimulation. For many men, this tissue plays an integral role in sexual pleasure and arousal, and understanding this function is key to making an informed decision about your health. While the removal of this tissue, a procedure called circumcision, has been practiced for thousands of years for cultural and religious reasons, today many people approach this decision from a purely medical and health-oriented perspective. Before we dive deeper into the complexities of the mature male body, I want to remind you that your health is your most valuable asset. If you find value in this information, please take a moment to like this video and subscribe to ElderWell Living. Your engagement helps us reach more men who need this evidence-based guidance. If you have any questions as we go along, feel free to share them in the comments, as I often look there for topics to cover in future sessions. Now let us look at the other side of the coin and explore why so many medical professionals discuss the documented benefits of removing the foreskin, especially regarding hygiene and disease prevention. The biological architecture of the prepuce is far more complex than many realize, and as we age, understanding this structure becomes vital for maintaining our quality of life. The foreskin is not merely an extension of the external skin. It is a specialized junction of mucous membrane and dermis, much like the eyelid or the inside of the mouth. This unique composition allows it to perform its primary duty, acting as a biological shield. For a man in his 50s or 60s, the skin often begins to lose its natural elasticity and moisture, making the protective role of the foreskin even more pronounced. By shielding the glands from the constant abrasive force of denim or cotton fabrics, the foreskin prevents the head of the penis from becoming dry, calloused, or irritated. This ensures that the underlying tissue remains supple and responsive, which is a cornerstone of sexual comfort as we get older. However, the complexity of this tissue also introduces specific challenges for the mature man. The space between the glands and the foreskin creates a unique microenvironment that is naturally moist and warm. While this moisture is intended to facilitate natural lubrication and ease of movement, it can also become a double-edged sword if hygiene practices do not evolve alongside our changing bodies. The inner lining of the foreskin is rich in specialized cells that contribute to the chemical balance of this area. But these same cells are also highly sensitive to changes in pH or the introduction of external bacteria. For men managing chronic conditions like diabetes, which can be more common in our demographic, the sugar levels in the body can actually alter the environment under the foreskin, making it more susceptible to yeast or bacterial overgrowth. This is why the conversation about keeping or removing the foreskin is never just about aesthetics. It is about managing a living, breathing biological system. When we talk about the sensory experience, we are talking about a sophisticated network of specialized nerve endings known as Meissner's corpuscles. These are the same types of nerves found in your fingertips, designed specifically to detect fine touch and subtle changes in pressure. In an uncircumcised male, the movement of the foreskin during intimacy provides a mechanical stimulation that many find essential for reaching the heights of arousal. However, as we age, our neurological pathways and sensitivity levels naturally shift. Some men find that they require more stimulation to achieve the same results they did in their 30s, while others find that the presence of the foreskin provides a necessary layer of protection against overstimulation or discomfort. This balance is incredibly personal and varies significantly from one individual to the next. It is also important to consider how the anatomy changes over time. At birth, the foreskin is fused to the glands, and it typically becomes fully retractable by adolescence. But for the aging man, the reverse can sometimes happen due to a loss of skin collagen or recurrent minor inflammations that lead to microscarring. If the skin begins to tighten, the very architecture designed to protect can begin to constrict. This is why a regular self-assessment is so important. You should be able to retract the skin easily and without any pain or resistance. If you notice that the sleeve is becoming more difficult to move, it is a sign that the biological architecture is shifting, and it may be time to consult a professional. Understanding this architecture also helps us appreciate the gliding mechanism of the uncircumcised penis. This mechanism reduces friction not just for the man, but often for his partner as well, by allowing the skin to move with the body rather than sliding against external surfaces. This can be a major factor in maintaining a satisfying intimate life well into your senior years. Yet we must balance these biological perks against the long-term maintenance required. As we move into the next section, we will explore what happens when this delicate balance is disrupted and how hygiene becomes a central pillar of your health strategy if you choose to remain uncircumcised. The goal is to ensure that your anatomy serves you, rather than becoming a source of chronic discomfort or medical concern. When hygiene becomes a medical burden, it is often because the natural maintenance of the uncircumcised anatomy requires more deliberate care than many men realize as they age. One of the most common issues I see in my clinical practice is the accumulation of smegma, which is a thick, whitish substance composed of shed skin cells and natural oily secretions. While smegma is a perfectly normal biological product and is essentially harmless in small amounts, it can easily be washed away with regular cleaning. However, if hygiene habits are not maintained, this substance can accumulate, leading to a noticeable odor and creating a fertile breeding ground for bacteria. For older men, especially those who may begin to experience challenges with mobility, vision, or manual dexterity, the simple act of retracting the foreskin to clean the area thoroughly can become increasingly difficult. The danger of poor hygiene in this area is that it frequently leads to chronic inflammation and infections. A primary concern is a condition called balanoposthitis, which is the inflammation of both the glands and the foreskin. Because the area under the foreskin can trap moisture and bacteria, the risk for this condition increases significantly if the environment is not kept clean and dry. For my patients, I often explain that this is not just a matter of being clean. It is a matter of preventing a cycle of irritation. When the skin remains inflamed for long periods, it can lead to the development of scar tissue. This scarring can eventually cause the foreskin to lose its elasticity, leading to further complications that we will discuss later, such as the inability to retract the skin at all. Furthermore, we must address the reality that the uncircumcised penis is simply more complex to maintain than the circumcised one. Because a circumcised penis has an exposed glans, it is generally much simpler to keep clean because there are no folds or hidden areas to trap debris. This simplicity is a major advantage for men who want to minimize their daily medical to-do list as they get older. In my experience, many men in their later years find that the transition to a circumcised state, whether by choice or medical necessity, relieves a significant amount of anxiety regarding personal hygiene and the fear of developing an embarrassing odor or a painful infection. It is also vital to consider the role of underlying health conditions like diabetes in this hygiene equation. High blood sugar can lead to an increased presence of glucose in the urine and on the skin, which acts like fuel for yeast infections. If you are uncircumcised and struggling with blood sugar management, the space under the foreskin becomes an ideal incubator for candida, leading to recurrent itching, redness, and discharge. This is where hygiene stops being a personal preference and starts being a medical strategy. I always advise my patients that if they choose to remain uncircumcised, they must commit to a daily routine of gentle retraction and cleaning with warm water. Using harsh soaps can actually strip away the natural oils and cause more irritation, so simplicity is key. If you find that despite your best efforts, you are still experiencing redness, swelling, or a persistent discharge, it is a clear sign that the local environment is out of balance. This chronic state of low-grade infection is not just uncomfortable. It is a risk factor for more serious cellular changes over time. This is why many medical professionals emphasize that circumcision significantly improves hygiene and, by extension, lowers the rate of various inflammatory conditions. As we look toward the future of your health, understanding these risks allows you to be proactive. In the next section, we will delve into the even more compelling evidence regarding how this anatomical choice affects your protection against more serious viral threats, including HIV and HPV. The fortress against modern pathogens is one of the most scientifically robust arguments in the ongoing discussion about male circumcision, particularly as we look at global health data. This is where the evidence becomes very compelling and moves beyond simple matters of personal preference. Several major, large-scale randomized controlled trials, including landmark studies published in prestigious medical journals like The Lancet, have provided us with high-quality data regarding the protective benefits of removing the foreskin. The results of these studies were consistent and clear. Male circumcision was found to reduce the risk of acquiring HIV through heterosexual intercourse by up to 60%. For a man in his middle years who may be re-entering the dating world or simply wants to prioritize his long-term safety, this statistic is a powerful factor to consider. The research into viral protection does not stop with HIV. These same studies also showed a significant reduction in the transmission of HPV, the human papillomavirus. HPV is a particularly insidious virus because it can cause genital warts and is a major leading cause of cervical cancer in women, as well as penile and throat cancer in men. Furthermore, there has been a documented decrease in the risk of acquiring herpes simplex virus type 2, which is the virus responsible for genital herpes. When we look at the data, it becomes clear that removing the foreskin acts as a form of biological risk mitigation. It is believed that this protective effect is due to the specific nature of the inner foreskin tissue. Unlike the outer skin, the inner foreskin is thin, non-keratinized, and rich in specific immune cells that HIV and other viruses target as a primary gateway for entry into the body. By removing this vulnerable tissue, you are essentially removing a primary point of access for these infections. However, as a physician, I must emphasize a critical point that is often misunderstood. While circumcision reduces the risk, it does not eliminate it entirely. It is not a vaccine, and it should never be viewed as a substitute for safe sex practices. Using condoms remains the most effective and reliable way to prevent the transmission of STIs. For my older patients, I often explain that our immune systems naturally become less robust as we age. This means that any anatomical advantage we can give our bodies to ward off infection is a step toward longevity. The reduction in the risk of chronic viral loads also has a secondary benefit. It lowers the lifetime risk of developing penile cancer. While this type of cancer is very rare in developed countries, its risk factors are closely linked to chronic inflammation, poor hygiene, and persistent HPV infection. Since circumcision improves hygiene and lowers the rate of HPV, it is directly associated with a lower risk of this serious disease. For the middle-aged and elderly man, the decision to undergo circumcision for these preventative health reasons is often a strategic one. We are no longer just looking at the immediate future. We are looking at how we can maintain our health and vitality for the next 30 or 40 years. If you are in a situation where you are managing multiple health factors, reducing the potential for viral infections and chronic inflammation is a wise move for your overall systemic health. It is about creating an environment where your body can thrive without being constantly bogged down by localized infections or the threat of high-risk pathogens. As we weigh these significant medical advantages, it is only fair to look at the nuances of the human experience. We cannot discuss the removal of tissue without talking about what that tissue provides in terms of sensation and pleasure. This leads us to one of the most debated topics in urology, the relationship between the foreskin and sexual sensitivity. In the next section, we will dive deep into the sensory changes that occur after circumcision, exploring the process of keratinization and what it truly means for your intimate life as you get older. My goal is to ensure you have a balanced perspective, acknowledging both the clinical protections and the personal physical realities of this choice. Sensitivity, sensation, and the keratinization mystery represent perhaps the most frequent concerns I hear from men considering their options in later life. As we have discussed, the foreskin is packed with thousands of fine touch nerve endings that contribute significantly to sexual pleasure and arousal. Removing this tissue will, by definition, change the sensory experience of the penis because you are physically removing a highly responsive part of the anatomy. For a man who has lived 60 years with this specific sensory map, the idea of a change can be daunting. However, it is essential to look at the actual biological process that occurs after the surgery to understand what less sensitive really means in a clinical context. Once the foreskin is removed, the glans is no longer protected by a moist internal environment and is instead permanently exposed to the air and the constant friction of clothing. To protect itself from this new environment, the glans undergoes a biological process called keratinization. This is essentially the skin's way of toughening up. The mucosal surface becomes slightly thicker and less delicate over time. While some individuals report a reduction in sensitivity that they feel detracts from their sexual experience, it is important to note that this is a highly subjective topic. In fact, many circumcised men report full and satisfying sex lives with no perceived negative impact on their overall pleasure. For some men, especially those who struggle with oversensitivity or premature issues, this slight reduction in the raw sensation can actually lead to increased confidence and longer-lasting intimacy. As we age, the nature of sensation changes regardless of our anatomy. Nerve conduction velocities can slow down, and the threshold for arousal often shifts. In my practice, I find that for the mature man, the quality of an erection and the emotional connection with a partner often play a much larger role in sexual satisfaction than the presence or absence of a specific fold of skin. That said, we must acknowledge the loss of the natural protective and lubricating functions. Without the foreskin to maintain a chemically balanced and moist environment, some men find they need to be more proactive with external lubricants to maintain the same level of comfort during activity. This is a simple adjustment, but it is one that requires a shift in mindset for those who have relied on their body's built-in systems for decades. The debate often pits more sensation against better health, but for many, the reality is a middle ground. While the foreskin is a nerve-rich tissue, its removal does not mean the end of a vibrant sex life. It means a different kind of sensation, one that is often described as less acute but still deeply satisfying. For those of you who are concerned about the all-or-nothing aspect of this change, I encourage you to think about your current comfort levels. Are you experiencing pain during erections due to a tight foreskin? Is chronic inflammation making intimacy a source of anxiety rather than joy? If the answer is yes, then the sensory trade-off of circumcision often results in a net gain in quality of life because it removes the barrier of pain. Ultimately, your body's ability to adapt is remarkable. Just as your hands might develop calluses to protect you while working in a garden, the glans adapts to its new environment while still retaining the deep pressure nerves that are essential for climax and satisfaction. It is a transition, certainly, but it is one that millions of men have navigated successfully. As we move forward, it is important to ground this discussion in the practicalities of the procedure itself. In the next section, we will discuss the surgical reality of adult circumcision and the specific challenges of recovery for the mature body, ensuring you know exactly what to expect if you and your doctor decide this is the right path for your health. The surgical reality and mature recovery process are aspects of adult circumcision that require a transparent and detailed discussion, particularly for men in their later years. While circumcision is a common procedure, undergoing it as an adult is a different experience than it is for an infant. Like any surgery, it carries a set of inherent risks, though these are generally very low when performed by a skilled professional in a sterile environment. These risks include pain both during and after the procedure, especially in the immediate healing period. There is also a risk of bleeding and infection at the incision site. For the mature body, the healing process may take a bit longer than it does for a younger man, as skin elasticity and blood flow naturally change with age. It is vital to follow your surgeon's post-operative instructions to the letter to ensure the best possible outcome. In some cases, there can be an unsatisfactory cosmetic result, such as scarring or the removal of too much or too little skin, which might require a corrective procedure later. This is why I always emphasize the importance of choosing an experienced urologist who specializes in adult cases. For a man in his 60s, the goals of surgery are often functional, relieving pain or preventing infection, but the aesthetic outcome is still a valid part of your overall satisfaction and confidence. During the recovery phase, which typically lasts several weeks, you will need to abstain from sexual activity and heavy lifting to allow the delicate tissues to knit back together properly. While this downtime can be an inconvenience, it is a necessary investment in your long-term comfort. One of the most frequently discussed disadvantages is the permanent nature of the change. Once the foreskin is removed, the glands will be permanently exposed to the friction of clothing, which leads to the keratinization process we discussed earlier. You are losing the natural protective and lubricating functions of the prepuce. For some men, this transition requires a period of sensory adjustment. However, it is important to remember that for those suffering from chronic issues, the removal of the diseased or problematic tissue often leads to a significant reduction in daily discomfort that far outweighs the temporary challenges of surgical recovery. For my patients, I often recommend a specific recovery protocol that includes keeping the area clean and dry, using prescribed ointments to manage the initial sensitivity, and wearing supportive clothing to minimize movement and friction. Managing expectations is also key. The immediate post-surgical appearance can be alarming with swelling and bruising, but this is a normal part of the body's inflammatory response. Within a few months, the surgical site typically heals into a clean, well-defined line. For many men, this marks the beginning of a new chapter where they are no longer burdened by the hygiene struggles or infection risks of their past. As we navigate the practicalities of the procedure, it is also important to acknowledge that for many men, concerns about sexual health go far beyond the foreskin. They relate to the core challenge of achieving and maintaining a strong, confident erection as the body ages. If this is something you have thought about, there are many natural ways to support your performance and circulatory health without relying on risky measures. Understanding your anatomy is the first step toward total body confidence. In the next section, we will transition into the specific medical red flags, the scenarios where this surgery is no longer a choice but a clear recommendation from a medical perspective. Medical red flags that demand action are the moments when the discussion shifts from personal preference to clinical necessity. In my years of practice, I have seen many men try to wait out symptoms that are actually clear signals from the body that the current anatomical state is no longer sustainable. The most common and significant of these conditions is called phimosis. This is a condition where the foreskin becomes so tight that it can no longer be retracted back over the glands. While mild cases might be manageable with topical steroid creams or better hygiene practices, severe cases of true phimosis can make proper hygiene nearly impossible. When the skin cannot be moved, smegma and bacteria become trapped in a way that no amount of external washing can reach, leading to a cycle of recurrent infections and chronic inflammation. For a man in his senior years, this can also cause significant pain during erections or intercourse, turning a part of life that should be joyful into a source of dread. A related but far more urgent condition is known as paraphimosis, and this is an absolute medical emergency. This occurs when a tight foreskin is retracted but then gets stuck behind the head of the penis and cannot be returned to its normal forward position. This creates a tourniquet effect, cutting off vital blood flow to the glands. If you ever experience this, it requires immediate medical attention to prevent serious and permanent tissue damage. In such emergencies, once the immediate crisis is resolved, a urologist will almost certainly recommend a formal circumcision to ensure that such a dangerous event never happens again. It is a definitive cure that provides long-term peace of mind. Additionally, for men who suffer from chronic, recurring infections like balanoposthitis that simply do not respond to antifungal creams or improved hygiene habits, circumcision is often the most effective permanent solution. We must also consider the role of the urinary tract. Studies have shown that the presence of the foreskin can sometimes contribute to a higher risk of urinary tract infections, especially in those with compromised immune systems or those who require the use of catheters. In these specific medical scenarios, the benefits of the surgery far outweigh the risks of continuing with the status quo. The goal of a medical recommendation in these cases is to preserve the function of the organ and to stop the cycle of pain and infection that can take a heavy toll on your overall well-being. For the middle-aged and elderly man, these red flags often appear gradually. You might notice a slight loss of flexibility in the skin or occasional redness after intimacy. It is easy to dismiss these as minor signs of aging, but I encourage you to see them as early warning signs. Addressing these issues before they become emergencies or lead to chronic scarring is the hallmark of proactive health management. When we choose to act based on medical necessity, we are choosing to protect our future mobility and comfort. We are ensuring that we can stay active and confident without the constant shadow of a recurring medical problem. As we move toward the final part of our journey, I want you to reflect on how these conditions might be impacting your daily life. If you find yourself checking for irritation every morning or avoiding intimacy because of discomfort, your body is already telling you what it needs. In our final section, we will discuss how to take these observations to a professional and how to frame the conversation with your urologist to ensure you receive a personalized recommendation that truly respects your history and your health goals. It is about empowering you to make the final decision for your longevity with total clarity and no regrets. As a specialist physician, I have seen many men struggle with the decision of whether to remain uncircumcised or proceed with surgery in their later years. Empowering your final decision for longevity requires moving beyond the general facts and focusing on your unique physical journey. As we have explored throughout this discussion, the decision to remain uncircumcised or to undergo the procedure is not a simple one-size-fits-all answer. It is a complex choice that should be made with a full understanding of both sides. For an adult who has no pressing medical issues, the decision is typically a personal one, weighing the potential health benefits against the risks and the desired cosmetic outcome. However, if you have any pain, discomfort, difficulty with retraction, or any other concerns about your foreskin, the single most important step you can take is to speak with a doctor. A urologist can perform a physical exam, assess your specific anatomy, and give you a personalized recommendation based on your body and your health. This is a discussion that needs to be had with a medical professional, not decided based on online forums or anecdotal stories. When you walk into that consultation, be prepared to discuss the history of your symptoms. Have you noticed a change in sensation or a recurring irritation that does not seem to go away? These are vital clues for your physician. For parents of a newborn, the choice is often based on cultural, religious, or preventative health beliefs. But for you, the focus is on maintaining a high quality of life for the decades ahead. We hope this balanced overview was helpful in clearing up the debate. The foreskin has natural useful functions such as protection and lubrication, but its removal offers significant scientifically proven health advantages, particularly in reducing the risk of certain serious infections like HIV and HPV. On the other hand, it is a surgical procedure that carries risks, such as bleeding or infection, and permanently alters the body. By weighing these factors carefully, you can choose the path that offers you the most confidence and peace of mind. Taking charge of your sexual health as you age is one of the most proactive things you can do for your overall well-being. Whether you choose to keep your natural anatomy or opt for the protective benefits of circumcision, the goal is to live without pain and with a clear understanding of how to care for your body. Remember that your health journey is personal, And there is no shame in seeking professional advice for these intimate matters. If you found value in this video, please give it a thumbs up, subscribe for more clear and factual health content, and share it with anyone who might be asking these same important questions. Your support allows us to continue providing the evidence-based guidance that men over 50 truly deserve. In closing, I want you to remember that your body is a reflection of your lifelong care. Stay curious, stay informed, and never hesitate to advocate for your own comfort and longevity. You have the power to make decisions today that will ensure a vibrant, healthy, and confident future. Thank you for being part of this conversation and for prioritizing your health with ElderWell Living. Thanks for watching.